Now, back to the systemic therapy. The single biggest change in the last decade in the management of skin cancers is the development of drug treatments that are highly, highly effective for both melanoma, basal cell cancers, and squamous cell cancers, for all of them. This is some pictures from a study a few years ago of cemiplimab, which is a kind of immunotherapy drug, very similar to nivolumab or pembrolizumab. They go by the trade names Libtayo for cemiplimab, Opdivo for nivolumab, and Keytruda for pembrolizumab, because many of these are on TV commercials and so forth. People have often heard those names. We tend to use the generic name cemiplimab, nivolumab, pembrolizumab. Any one of these are kind of like Coke, Pepsi, and RC Cola. They are all the same basic drug, trying to taste the same way, work the same way. And that is by stimulating the immune system. And it's amazing that just a few treatments with an intravenous infusion of a drug every 3 weeks, the drug doesn't attack the cancer at all. Instead, it stimulates the immune system, and that stimulation leads the immune system to recognize, hey, there's something going on that I missed, and it starts to take care of it. So here it is. The top part of this slide is a stage T4, meaning greater than 4 centimeters, going down into the bone of the right periorbital area. On the CAT scan, the tumor is over here on the edge of the eyeball here, and it's this tumor right here in the middle photograph panel, and on the side next to it, that's the after just 4 doses of this intravenous treatment. You see how it has markedly improved. Here's another one, a different patient, different tumor, same thing. 4 doses of an IV drug, tremendous improvement. And even though it's clear in both of these cases that they're not back to normal, it often turns out that even though the skin hasn't totally healed up, the cancer is totally gone. There's nothing left. It's just such a big wound that it's going to take time to heal up. So sometimes the tumor just shrinks down and it's easy to remove. Other times it just sort of disappears, and it's still such a large area we can't easily do surgery, but perhaps we can now more easily do radiation. Other times we just use drug treatment and we never do anything else. This has really been a dramatic change in the management of these advanced skin cancers. It's a small fraction of the total, but when you're talking about 3 million cases or more a year, it doesn't take much for a small, tiny fraction to still lead to a lot of people who end up needing this kind of immunotherapy, as long as they have a normal and intact immune system. The problem comes if they've got a kidney transplant or a heart transplant or a lung transplant. These same drugs can stimulate the immune system to reject those organs with life-threatening consequences. So that is a big, big challenge remaining. How do we manage these cancers in patients who have an organ transplant or another problem like that with their immune system. Not all of the drug treatments are immune-based. For squamous cell cancer, there are drugs that target a specific receptor called the epidermal growth factor receptor, drugs like cetuximab. And we can see good responses sometimes to that particular drug. Usually, if we have a choice, the immunotherapy is more effective in a higher percentage of patients and with a more long-lasting improvement. But there are alternatives. Similarly, for basal cell carcinoma, it's not the epidermal growth factor receptor that we target. It's a couple of genes in a specific pathway that we call the hedgehog pathway. Hedgehog pathway inhibitor pills can cause dramatic shrinkage of even very large neglected basal cell cancers. But when you stop taking it, they will grow back. And even if you continue to take it long term, eventually the cancer often becomes resistant. So immunotherapy has turned out to be often the most durable long-term solution when we are dealing with very locally advanced skin cancers, but it's not the only solution. And we still have a big challenge in patients with immune suppression or organ transplantation.